and a warm welcome to this talk, which is basically a blatant excuse to give some airtime to Professor Angus Dalgleish in an interview we're going to see in a minute. Now, Professor Dalgleish is one of the main developers of the Mycobacterium vaccae vaccine, which boosts the immune system, keeps some cancers at bay, maybe others, we don't know yet, and probably prevents cancers as well. But the Medicines and Healthcare Products Regulatory Agency in my country refused to license it, which is really annoying because I want it to boost my immune system, but I'm not allowed it. MHRA won't license it on compassionate grounds, so my doctor can't prescribe it. Anyway, moving on. In this interview, Professor Dalgleish says, why on earth did they use mRNA vaccines? Where did that idea come from? Well, why didn't we use ordinary vaccines? Very difficult to say, because they have damaged people. There's no question about that. They have damaged people. And how long will they keep damaging people for is an unknown question, and it's one that is a current concern. Now, Professor Dalgleish had this rumbled pretty well from the start. He realised that the SARS coronavirus 2 escaped from a laboratory, and he realised that the vaccines were going to be useless and unsafe virtually from the start. Now, what should have happened back at the start of 2020 is the government should have gone and said, please, Professor Dalgleish, you seem to have how this worked out. Can you advise us, please? Of course, they didn't. Now I would appeal to the government to knock on his door and say, please, sorry we didn't contact you before. Can we please contact you now and get your expertise now? They won't, of course. At least they might do after this video. Who knows? Let's wait and see. Now, Professor Dalgleish pointed out that the virus had 6 inserts, which couldn't have arisen naturally. 1 could have arisen naturally, 2 in a really big push, but 6, I don't think so. And he pointed out really early on, again in the early parts of 2020, that the vaccine had 80% homologousness. It was 80% homologous to human tissues. What this means is the nature of the spike protein produced by the vaccine or the gene therapy produced antibodies which would also attack human tissues. They were homologous to human tissues. So the vaccine antibodies, the vaccine-induced antibodies that were designed to attack the SARS coronavirus 2 also attack human tissues, making side effects and autoimmunity inevitable. And he had this worked out in early 2020 when, well, very few other people did. There was a few around the world, but people didn't listen. We had a group called SAGE, which may have been slightly badly named. Scientific Group for Emergencies. Probably not very SAGE-full. But it's not too late. You know, Wes Streeting, our boss of health, can go around, and Minister for Health can go around and ask Professor Dalgleish for his help. I'm sure he would condescend to give it. So 80% homologous, guaranteed side effects, basically. Now, this is interesting. I didn't know this. Professor Dalgleish, apparently, there was some distribution of this knowledge through the 5 Eyes. Now, the 5 Eyes, basically, I don't know much about it, but it's the Anglosphere intelligence, isn't it? So it's combined intelligence from Canada, United States, UK, Australia, and New Zealand. So in what way, this is a good question for the government, in what way was 5 Eyes involved? And what did 5 Eyes say at the time? Because it looks like there was some involvement of international intelligence. Tell us more, please, for government transparency, which of course we know that our governments approve of. Then he talked about we talked about to Josh Getsko about this, the fact that the vaccine was made in one way for nearly all of the recipients in the clinical trials, in the Pfizer trial anyway. And then they went on to making it from E. coli for the mass rollout. And of course, it's the E. coli is where we get the DNA contamination. So we had this simple bait and switch. The trial vaccine, nearly all of it wasn't the same stuff as in the rollout. How did the Medicines and Healthcare Products Regulatory Agency, how did the vaccine people, the vaccine regulators, allow this to happen? How did they not know about this? Or did they know about this? And if they did know about this, why didn't they act on it? They could maybe answer that question. I would be interested to know the answer to that. Professor Dalgleish is concerned about contaminants like the DNA going into the genome, into the human genome. If they go into the human genome, it could stay there for the life of the individual. Potentially, and I have no evidence for this at all, but potentially if it goes into germ cells, it could go into the next generation as well. Let's hope that doesn't happen. The excess deaths were obvious after the vaccine rollouts. The fear about cancers going on into the future is still there. I have it myself. I have fears of that. The government needs to start collecting data on this because there's more cancer in young people. This data needs to be collected and rigorously analysed so that we get warning signs at the earliest possible stage. There's no COVID now, essentially, so why are we still having COVID boosters that may be causing turbo cancers? Now, turbo cancers is a term I've heard some serious oncologists and surgeons using lately. It's not a term that you'll find in the medical textbooks, at least not one that's more than a year old, maybe. It's a very new term, and yet senior people are using that because it's very descriptive. Cancers that present at a very advanced stage and basically metastasize and result in loss of life very quickly. Professor Dalgleish also questions the intellectual capacities of the chief medical officer in his own turn of phrase. Watch that; you won't fail to be. Watch it. Now he says that he points out the chief medical officer, Chris Whitty, in my country, said we need to vaccinate kids to protect grandparents, but grandparents had already been vaccinated, so why weren't they protected? So we were, according to the chief medical officer. So he was saying that the old people were protected by the vaccines. Then he was saying, but we need to vaccinate young people to protect the old people who are already protected. So why did they need protected from young people if they're already protected from the vaccine? Makes no sense at all. It makes no sense at all. He's 100% right on that. We were vaccinating children to prevent people that should have been already protected. But of course, we now know they weren't already protected because the vaccine was ineffective. Gene therapy, going into the genes, DNA contamination, really quite concerning for the future. If this is true, this could go on giving adverse reactions for decades into the future. The cognitive dissonance that's around at the moment, so people that know one thing but behaving in a completely different way, very strange. Global regulatory bodies need to be held to account in all our countries. They need to be held to account. The individuals who signed off on this should say why they signed off it in clear terms, not in some legalistic hedged terms in some inquirers which are less effective than some of us would like to see. And he uses terms, I can't remember the exact term, something like dystopian totalitarianism. This is part of a wider problem. That us hoi polloi, us plebs, us proletariat, just receive what filters down from on high, what the elites choose to give us. This is a big part of the problem. Right, I'm going to hand over to Professor Dalgleish now. Tucker Carlson has had Dr. Patrick Soon-Song on talking about cancers. I do plan to talk about that. I've had lots and lots of requests for that. And Joe Rogan has had Dr. Susanna Humphries on as well. So great to see that Tucker Carlson and Joe Rogan are really moving into absolute world leaders in health. Patrick Soon-Song is a very, very he's an amazing guy. He's a transplant surgeon. He's a cancer surgeon. He knows all about lots about immunology, and is also a very successful entrepreneur as well. Amazing guy. And Susanna Humphries has got some really interesting ideas, which I'm only just learning about myself. Anyway, on to Professor Dalgleish now. Thank you for watching.
And it's very clear now that why on earth did they do this? I mean, I have no idea, because from the very beginning, these vaccines were not vaccines, particularly the ones that ended up after AstraZeneca with all the clots and they were shut down. But the messenger RNA vaccines of Pfizer and Moderna have caused unbelievable problems and damage to people, and I don't think we will ever really be able to get over that. I mean, the whole concept I challenged from day one. I said, right from the beginning, this virus escaped from the laboratory. It has 6 inserts that could only have been put in manually. My peers said, well, this can occur randomly. I said, no, once, but not 6 times. This has been interfered with. And the most important thing, we said that the vaccine was 80% homologous to humans, so it was bound to cause major side effects. Now, why did everybody go along with it? I mean, we informed everybody, the government, through the Five Eyes process, that this would happen, but everybody ignored it. So why did this happen? And now we know that it's even worse than that the vaccines the quality control was appalling. They changed the mechanism of manufacture between the trial and the rollout to about 6 billion people. This thing was full of contaminants. It was full of sequences that can actually get into your genome. And my big concern is that a lot of them explain why that a couple of years into this epidemic, we still have massive excess deaths. Excess deaths in Australia, New Zealand, and everywhere. And a lot of these now are due to cancer. And that's basically what I want to discuss here. The red flags are so enormous. Why has the government not banned these vaccines immediately? For a start, COVID doesn't exist anymore. And if it does, it doesn't kill anybody anymore. So why are you using vaccines, boosters that we now know increase the rate of cancer, and the cancers are appalling, they're turbo cancers? Well, I mean, I think this is right. It was draconian, dystopian, and totally unnecessary. I mean, I've criticised our own Chief Medical Officer, Chris Whitty, and I'll use the words again, as a total moron. He basically wanted to vaccinate our children in order to protect their grandparents. So in that one sentence, he said he knew nothing about vaccines. You only vaccinate to protect somebody else. You do not vaccinate to protect other people. And by that sentence, he said, well, the vaccines didn't work because all the grandparents and parents had already been vaccinated. It was unbelievably stupid. No child died of COVID unless they had some underlying condition like leukemia. It was absolutely abhorrent that they would even think of this. And they were pushed into this by Pfizer and all the people that Pfizer and Moderna wanted to get this into absolutely everybody. These were not vaccines. These were horrible gene therapies that could actually integrate into your genome. And this is one of the reasons we're seeing this horrendous rise in turbo cancers. I'm terrified what they have done to our children. I think everybody who went along to that should actually stand up to trial, defend themselves, and go to court. This is unbelievable, the incompetence, medical negligence, everything, and nobody is accepting responsibility for this. It is unbelievable case of cognitive dissonance, and I hold everybody to account. I hold the chief medical officers to account, the chief scientific officers to account. The so-called, in the UK, we had SAGE, one of the most inappropriate acronyms ever. But, it is unbelievable what we had to. Now, I cannot believe the MHRA and the TGA and the FDA, the level of incompetence and negligence, and they have to be held. This is Nuremberg trial stuff. They are so awful. Now, we know about the contamination. Your TGA have stood up and said, oh, we've done this little study, that study, what have you, but it doesn't really matter because they're safe and effective. They started with the mandate that these vaccines were safe and effective. No, they were never, ever effective. I've looked at the first submissions of Pfizer to the FDA. There was no evidence that they were effective whatsoever. It was basically hope. And they were never, ever safe. The first the first submission of Pfizer showed that they caused every single side effect you could ever possibly want, and yet the FDA still approved them, and the TGA and the MHRA went along with it. This was absolute criminal negligence. Their job was to say, are they safe? Are they effective? No, they were not. And yet they signed off on it.